Welcome everybody back from Memorial Day. I hope yours was refreshing. I was in Sedona, Arizona. We had a blast, including getting a tire literally blown off our Jeep in the middle of a desert with kids and I putting the spare tire on. I think that was quite an entertainment. But it was great. I think that we all need to start feeling like the partially life comes back to normal. Despite that, actually, the person we were staying with, their 19-year-old kid flew to a party in I think it was Wyoming, and then came back with a pretty bad case of COVID. He was not vaccinated. So he's better now, but he had it rough. So I see there was already Benita saying so there's a lot of cases. We'll talk about that in a second. But I want to let everybody know, in case you didn't hear or see that we are having our open house at C-IAYT tomorrow, dedicated specifically to long COVID. I'm going to put the link in the chat. And Ashley, if you want to say a word or two about it, since Ashley and I are going to lead it tomorrow. And I hope we'll see you there.
Yeah, I think that it's going to be a great space for us to talk a little bit about our sort of treatment strategies for long COVID, some of the mechanisms that are thought behind, why long COVID exists, or what may be the underlying causes, and then also create a space for people to ask, questions that they have in regards to long COVID, or maybe things that they've tried, and have some collaboration.
Yeah, and we're going to have a pretty big team. Hopefully, we're going to have physical therapy join, speech therapy, cognitive therapy, memory clinic, pulmonary therapy. So all the services are said they're going to try to come. I don't know, it's Saturday, so I said we can't really ask practitioners to sort of show up in large volumes. But so we are going to be the main clinic at GW for long COVID. The GW Medical Faculty Associates closed the long COVID clinic, and it's very unfortunate because that was an insurance-based clinic. But because it was an insurance-based clinic, it was unsustainable, and administration said it was losing money, and they shut it down. So yeah, but hope to see you there. I put the link in there. I'll put it at the end of the meeting there as well, because we are going to I have some other people probably join a little later. So that's my quick thing. A couple other quick things. I know some of you have been very aggressive about Novavax. I appreciate that, and you probably heard that the Novavax is applying for emergency authorization finally after all this time. I still think it's not going to happen, but maybe I'm wrong. So we'll see. And the last thing before I head to questions is fascinating study. I'll put it in the chat about the fact that dogs seem to be able to detect acute COVID, even asymptomatic, way better than any existing tests. So the almost 100% accuracy. They're just sniffing, basically. And it's interesting that I posted the same link. Not the one I was trying to post. What's really interesting is that it appears that dogs can sniff a lot of illnesses. There's been a literature and publications on dogs sniffing cancer as well as other infections. So I think we're yet to learn from our furry friends a lot more than we think. So with that, the drill, questions in the chat. And I have about a couple of minutes, I think, before we head over to...
You got time.
Yep. I don't see any questions.
Me either.
Wow. Well, I don't have anything else, honestly. I on purpose wanted to leave more space for questions. So
okay, then you know what, Misha?
Yeah.
Let's spotlight Dr. Baer.
Sure, great.
And she can get started, and that means we'll have answers for the questions I'm sure she's going to have afterwards, because it was amazing the questions that I was sent and forwarded to her. Anyway, Dr. Baer, just tell folks a little bit about yourself, your practice, and then.
Okay. Hi, I'm Kim Baer. I practice in North Bethesda, Maryland, and we've been there. I've been there since 2000, and we're a biological, I guess, holistic, well, functional medicine type dental practice, and we, focus on basically using biocompatible materials and basic and trying to only use, things that would actually be compatible with each of our patients. It's very individualized. The idea that one material works well for everybody is just doesn't make any sense. And we are very active in the community as far as we do a lot of volunteer work, and we're just all about educating people. I think especially in this country, a lot of times we're our worst enemy, and people think, the more fastidious they clean their teeth, or, we see a lot of problems that come from that. It's more about, what you're using, and definitely more about how you're taking care of yourself, not so much the products that you're using in your mouth. But so there's, toothpaste, over-the-counter toothpaste. We don't believe in fluoride. We don't use fluoride. Fluoride is a carcinogen. If you just used fluoride for when you were in the dental office, there would be some topical use for it, but it's not meant to be ingested, and we all get far too much fluoride. There are other things out there that you can use to prevent tooth decay that aren't harmful to your body. Like, for instance, we really like aloe. Aloe is great for your teeth. But even that being said, the most exciting thing, especially this past year, that we've seen in our practice, and it was very big in Switzerland and Europe, is I have to say the number one thing that actually we see make a difference in as far as getting cavities and bone loss in your mouth is we're really becoming involved in getting our patients' vitamin D and K levels up. It just makes sense. It's crazy. I thought I was very healthy, and I was taking a ton of D and K capsules, very good quality. And then when I went over to Switzerland last fall and they were doing testing on us, I was in the chronic disease category. And I had to switch to a liquid to really get my levels for my age, because as you age, you need more. And if your stress levels go up, you need even more. So when you're having dental work done or dental surgery, those levels need to be high, or else it's going to affect your healing. It's going to affect your bone growth. For instance, like we place a lot of ceramic implants, and we have our patients get their levels elevated before we even place them, because it basically eliminates our failures. It's crazy how effective it is. Any questions? I'm sorry, I can't hear anybody.
I'm sorry.
The questions come in the chat.
Okay.
Yeah, so I see there are people, but I think everybody's a little behind today. I think everybody's waking up.
Okay, sorry.
I see tons of questions that are COVID related suddenly. So how about we just kind of talk and see, because I see all the questions. There's some questions are for you, Kimberly. So maybe what we'll do is, there's a question about flossing and then lipospheric forms.
Okay, let's see.
So I'm going to make a suggestion. How about we, I'll start putting the questions that I received a few weeks ago into the chat window for Dr. Baer. Misha, let's hold the COVID questions until
Agreed.
after Dr. Baer is done.
Perfect. Let's do that.
Okay.
Both those questions were from me. So there's, in New Zealand, there's a big push on flossing. And it's interesting about fluoride. I live in Canterbury, and it's the only area in New Zealand that doesn't have fluoride in their water at the moment, but they're talking about putting it in supposedly for our health. And of course, all the questions about how do you control the dose? And if I drink 2 liters of water and someone else drinks 3 liters of water, and if somebody's 65 and somebody's 12, and so all of those questions remain unanswered. But with flossing, I use a water pick, and I find that helpful. But I just wondered, in your experience, people have often said it's, yes, you can brush your teeth, but actually it's about gum care and making sure that, you're making sure those little bits of food, especially as you get older and the gaps between the gums increase. Would you like to comment on that?
Yeah, I love water picks. Water picks are amazing. They're just, because usually, flossing is important, but we do see damage with flossing. People get a little too rough. So yeah, I mean, you'd be surprised how gentle you need to be to get the best results. I remember in going to dental school and them showing us exactly how, when you brush your teeth, whether it's with an electric toothbrush or a regular toothbrush, if the bristles bend, it's too much pressure, it's too much pressure. So it's so gentle. That's all you need. I mean, your body is designed to self-clean your mouth. Clearly, if you're healthy, and the problem is many of us are on a million medications, and we're, our whole biome in our mouth is being affected, and so we have to go that extra length to clean, and because we're just not, in a situation where we're healthy enough to just allow our body to take care of it. But yeah, the water pick's great. The water pick's great. Flossing's important. The fluoride thing, I just don't understand, because we know, and we learned this even in the 90s when I was in dental school, if a patient eats a tube of toothpaste, or, that it's not good to ingest it. You're not supposed to ingest it. It accumulates in your bones, and, it's a pesticide. It's great if you were to just use it on the surface of the tooth and seal it in there, but you're not supposed to let your patients ingest it. But we're putting it in the water. It doesn't make any sense. It doesn't make any sense. And there's that study at NIH did, and I think it was 2003 maybe, where they lowered children's IQ 20, some crazy number across the board. I mean, it's just not. It doesn't make any sense. I don't.
Yeah, we had a spokesman for the Auckland District Health Board, John Calhoun, and he was initially pro-fluoride, and then once he looked into it and saw that actually it seemed to make no difference, he then reversed that because of all the adverse effects. So yeah, thank you. So the other thing was regards to formulations with lipospheric forms, lipospheric D, and also, of course, the use of glutathione, and your vitamin C and your zinc and your other cofactors with regards to, again, to gum health. You mentioned liquid forms. I'm just interested to know more about what you were thinking when you mentioned those.
Well, I meant lipospheric. Most people don't, would consider that a liquid form with our patients. We keep it in the office. We use the Quicksilver, glutathione, and vitamin C, and the D and K. I love it. It doesn't taste good. It doesn't taste good, but you get used to it. It tastes like mothballs, especially the glutathione. But when I actually got my levels up, the difference was crazy. Even with my skin, everybody in my family dies of weird skin cancer. I'm like a vampire, but I noticed right away, it didn't burn so easy, and, really crazy things. So yeah, I'm a big fan of it. I mean, some people might do fine with the capsules, and I'm sure they do. I know they do because I have many patients that do the capsules and their levels are good. But I know for me, that was, my body just didn't do well with.
Okay, so it looks like we have a hand raised. Sheila, go ahead and unmute yourself.
Hello, how are you? I was wondering, how safe are implants? When you get teeth put in, they want to put those titanium implants or whatever in there. I don't think there's much of an option of anything else, but I was always kind of hesitant because of the metal and the titanium. So could you kind of speak on that?
Sure. I place a lot of implants. I started placing implants in 2000, long before I, was into functional medicine. I think that metal cannot be an option anymore. I think with, Wi-Fi and 5G, I mean, there's, NIH just released something, I think it was last year. These Wi-Fi levels are creating situations, even with like your amalgam fillings, where it's like doubling the amount of mercury that's pulling off of it. I mean, you can't, I think that it's metal is gonna, I spent the first half of my career putting in metal implants. I'm probably gonna spend the second half removing them. I mean, I think our environment's changing very quickly, and metal just doesn't have a place in it anymore in our bodies.
So
So
what's the alternative to metal for implants?
They have zirconia, like it's like a ceramic. It's actually, the Swiss ones are great. I see, your gums grow on them, your tissue loves them. They're completely inert, unreactive. Right now, that's the best.
That you can use to put in new teeth with the zirconia. Is that what you're saying?
Yeah.
Okay.
Yep. And it's that, they've been around a long time. In this country, not as long, but the research is out there, and even with, the EMF and Wi-Fi, it does well. So right now, that's what I would do, and that's what I am doing.
All
Okay,
right.
I have another question. Can you describe a bit more about your approach to dental care? Do you do x-rays and fill cavities like a regular dentist?
Yes. X-rays are very important. The digital x-rays are the good systems, or it's less than a phone call on your cell phone. And, you don't need them all the time, but it's the goal, the idea is you want to minimize your dental work. You don't want to not do any dental work and then need a ton of dental work. So we do regular x-rays. Some people need them more often than others, depending on what's going on with them. And we do fillings. We use a porcelain-based filling material. Looks like, the composite resin. I used to test everybody, and but then what I found is that like the porcelain ones are, everybody's fine with certain ones. So then we just across the board, so people wouldn't have to pay to get their testing done. We just put everything in the office that was as biocompatible as, we could find. So
okay. Another question. For those that haven't been to the dentist in a while because of COVID, but have no teeth pain or any obvious issues, what do you recommend? Also, are you accepting new patients?
Yes, we're accepting new patients. I recommend coming in. I would recommend coming into us or another office and getting a comprehensive exam, and have making a plan. I mean, we're living a long time, and you want to minimize your dental work. That should be the goal. And there's plenty of work out there for us to do. We want to minimize it. Like it's fun. It's a challenge. So yeah, you just gotta, just want to get in there. People always think it's going to be worse than it is. I can't tell you how many patients have come in after COVID and they think their mouth is falling apart, and it's nothing. It's little things, and they're in great shape. So yeah, don't let that, stop you from going.
Okay, another question. Is there more Is there more one must do as an older person, a senior age group person, to keep gums and teeth from deteriorating? Or is it just the same stuff that we're always told?
Probably the same stuff with the exception of your, mineral. You just really want to be on top of your mineral absorption, make sure there's no issues, and your D and K probably need to be higher. If you don't have a functional medicine doctor, that I would definitely recommend. We have so many great ones in the area. And you want to just be preventative. You don't want to wait till there's a big problem.
I just want to quickly clarify, we're talking about K2, everybody, and it doesn't really matter whether it's MK4 or MK7. Most people will get MK7 because MK4 is much more expensive. But if you have osteoporosis, MK4 is a lot more evidence. We actually had the whole talk about this a while back, but I think it's actually a great topic to ask Lee or Dr. Frame or myself to cover as a whole separate standalone conversation, because I actually think, especially since people overdosing on vitamin D, and if you're taking more than 5,000 or 5,000 units or above, you absolutely have to take K2, because there's a pseudo deficiency of K2 that ensures if you do not take K2, because the same exact receptors compete for both nutrients, and they're actually both hormones. They're not vitamins. It's also a misunderstanding. Since they regulate the actual processes, they're not cofactors per se. So it's a really important topic. Just want to highlight that. Thank you so much for bringing it up. And I'm kind of interested if there's a particular literature question also. There's particular literature on the dental health in K2.
Well, one of the things I'm going to do probably this afternoon is shoot off an email to Dr. Baer to give me links for some of the things she's talked about, because a lot of what you've talked about, I haven't thought about at all. So I'm so glad that you agreed to come on. So we have another question. What kind of toothpaste would you recommend? Anything fluoride free or something specific?
So usually I'll tell my patients, we have ones we like. I like the Risewell. You can get it. I think you can get it on Amazon. It's vegan. But really all you need is something that I like fluoride free, and I want something that doesn't have SLS in it, sodium lauryl sulfate. So like takes a little getting used to, because that's the stuff that makes it real foamy. But yeah, that stuff is very irritating. And if you're prone to getting cold sores or like any herpetic lesions, a lot of times that's what the problem is. It's actually the toothpaste that's irritating it and creating outbreaks. So you just want to stay away from those things. And, I just think things are so harsh, and I like something with maybe an oil in it.
So what are your views on Sensodyne?
Sensodyne can work as far as sensitivity wise. Problem is, I think they have a fluoride free one. I think they do. They have a fluoride free one. They might have SLS in it. I used to be all about Sensodyne. Now we use something called MI paste, which is a calcium paste, which works even better and has nothing bad in it. If you really need to use it, I would just use a fluoride free one.
And does anybody else have any questions they would like to ask Dr. Baer? You could unmute yourself if you'd like.
I just want to know that liquid product you said that's doing wonders with the D, I think, and the K. What is the name of it?
So the one we're using in the office is we use one from Quicksilver. You can get, I think they have a website.
Okay.
You can look it up. There's a few. I can give you the links for them. That one, the Quicksilver one's a little expensive, and I'm not 100% sure if you can get it directly from them or if you have to get it from a provider. But I like the liposomal ones for sure.
You like the liposome? Could you spell that?
It's like a liposomal, liposoml. I don't know. I can give you a link. I don't want to try even attempt right now.
I will try to get as many links from Dr. Baer as possible. Okay, everybody?
Okay,
Okay.
This is Jade. I had a question. What about Tom's toothpaste?
I mean, same thing. If I know they have a fluoride-free one, and you want the one that's SLS free.
Okay, thank you.
All right. Thank you so much. Folks, if you want more of Dr. Baer, she did an amazing podcast episode with Dr. Andy Wong, who we've had come and talk to us several different times. I'll also make a point of including that in our after event email today, okay? Dr. Baer, you are the bomb.
Thank you so much.
All right. Now it is time for our mind body session.
Hi, everybody. So I'm Yael, and I thought thank you so much for inviting me to be here, and it's nice to see so many familiar faces. Today we're going to do a little yin-inspired yoga. So yin yoga is named from the concepts of yin and yang, which are not polar opposites like some parts of our collective society right now. I won't say which parts, but I bet you we can all guess. But they're more like polarities that meld into one another. So yang, for example, is considered to be a little bit more activating and generative, more creating. We live in a very yang culture. Go out there, do things. And then yin is considered to be a little bit more receptive and allowing, intuitive. It's really where we gain our intuitive skills as well. So we normally practice yin yoga on the ground, but I thought today we could do a little bit of chair yin. And if you have with you, I'm gonna actually sit back, not be right up at my computer. And I just want to confirm I put on my AirPods so that folks can hear me. Can you guys hear me? Okay. Yes, okay. Let me I've got a couple of devices so that I could see you guys better as well. Okay, so the only things that you might need today is at least one kind of block, or a stool would do really well. I've said this before in here, but blocks are like so wonderful. These are a little heavy because they're made out of cork. Well, the doctor always says I'm 5'1", but they lie. They give me that. I'm 5 foot, I think, and a half an inch. So you could see that if I were to sit back in my chair, my feet would not, I mean, they sort of not meet, but not exactly. I know that Niall, who's an occupational therapist and who's been here a lot, McFarlane, has talked about different angles that we want for our seat. And so it might be really helpful for us to have like blocks or books so that your knees are about at the level of the hips. And Janet, I'm going to ask, because I can see that there's some chats, but they might be coming in for Dr. Baer. But if there's anything for me, if you could just read it. So if anyone has any questions, or if people can unmute, because I won't be able to look at them. Okay, so yeah, so if you're vertically challenged, then feel free to give yourself a little bit of height. And we're going to be holding poses for like a minute to two. In most yin practices, we would be holding for up to 5 minutes, but we're kind of going light today. And let's just start with just a little grounding meditation. And I'm going to recommend a mudra. And a mudra is a gesture that we use for our hands. They sort of work along energy lines in our body. There's one, I'm gonna offer two, which are very related. So the first one is called Apana Mudra. And so in that one, you would take your, it's the Nixon Mudra, my friend. So, you would take your middle finger and ring finger together right at with your thumb. And then you could put it on your lap, hands up or hands down. And a related one is sometimes called pranadharma, and it's the same mudra, but then you would connect both index fingers and both pinky fingers. They have about the same effect, which is really about letting go. So apana is in both the yogic tradition and also in all the Asian medicine traditions, like Tai Chi, which has also really influenced yin yoga. There are these inner winds, these ways that energy travels, and apana is the wind that travels down. So I want to talk today about just sort of releasing and letting go. And so this is a really great mudra for that. So if you're comfortable, and if you're when you're sitting on your chair, I'm going to invite you not to do Shalampasana, but to instead come a little, I'm glad that you're laughing, but instead to come a little bit more just forward. So you don't have to be rigid, but just relaxed and upright. And if it's comfortable for you, you're welcome to close your eyes. Or my other recommendation would be to not look at the screen, maybe look at a plant or something beautiful in your room, or a tree outside if you're lucky enough to have a window where you are. And you don't have to do anything here except begin to just notice how you are in the space that you're in. And you could really notice how the places where your feet meet the ground or the blocks, or your pelvis meets the chair. And it's also perfectly fine to rock a little bit forward and back or from side to side. These little micro movements give us so much feedback. And we could sort of take a kind of picture, if you will, of what our energy levels are like today. If it's comfortable for you, you could also use a few deeper breaths here to just anchor yourself into this practice. I know there was a lot of great information that came from Doctors Kogan and Baer, and you might still be a little spinning from that, but give yourself the opportunity to just be here for a different kind of personal self-directed health assessment. We'll just take one more big inhale here. And on the exhale, I'll invite you just to bow your chin to your chest. You can release the mudra. When you're ready, you can come back in the room, and I'm just sort of shaking out my hands, just releasing. And let's just start with a little bit of simple wrist work. So I'm just gonna take my hands as close to my armpits as I can. I've got the back of my hands by the armpits. And I'm gonna go ahead and just kind of allow my elbows to come down. So for some of us, for example, I'm no longer right by my desk, but another way of doing this would just to be take the top of your hands to a desk or a table, if that's easier for you than doing it on your body. Just take a few breaths here. And even here, what I want to invite you to do is just to soften any tension in your face, around the eyes, and around the jaw. When I think about softening my body, I often go back to an experience I had a couple of summers ago in upstate New York, where I was walking in a field and I came across a deer and her baby. And somehow I was 10, 15 feet from them, super, super close, and they didn't catch my scent. The air must have been going in the opposite direction, the wind. And I just tried to make my whole body as undefended, as little of a threat as I could. And so that's kind of the energy that I'm going to encourage you to go into. Let's go ahead, release your hands. It's the opposite movement. So we're just going to draw some just small circles here. Okay, and then let's go ahead and just do a little bit of yin for our neck. So I'll invite you just to drop your right ear over towards your right shoulder. Many options here in terms of hand position. You could take that same right hand and just lightly place it without pushing down on the left side of your skull. You could also likewise extend the left arm out, internally rotate through the shoulder, in other words, thumb down. And then we'll reach, some of us can do this, some of us can't. So I'm just giving it as an option. Could reach that left hand and just sort of use that left hand to gently encourage this right shoulder down. And we'll just take a few more breaths here. Your spine is still upright, even if your head is moving to the side. And by the way, if coming straight over to the side doesn't work, then just find a little gentle movement to find a different angle. And you're also welcome to close your eyes or keep them open and soft. Good, let's just take one more breath here. I'll invite you to keep your head as it is, just release the hands. Take your right fingertips to your temple and use your fingers rather than the muscles of your neck to bring your head back up. Let's go to the other side. So we'll drop the left ear over to the left side. And you could do any of those variations that you liked before. So when I'm talking about a soft body, there is a concept in, I don't know, I should have asked before, but there's a concept that really comes from Tai Chi, which is one of the internal martial arts. That has to do with loosening. And the term is called song or song fang, but we'll just say song, like S-O-N-G. And the image that's usually used to describe this concept of song is a woman who's letting down her hair, this loosening and expansiveness of beautiful hair, as opposed to being like coiled up in a bun, for example. So the idea with song is that we have the opportunity in all of our internal practices, whether it's Tai Chi or yoga, to notice places where we might be bound up. And sometimes we hold on to so much tension involuntarily and just under the surface of our awareness. And so the poses are not as important as the practice in Tai Chi, I would say, as well as in yoga, as this practice of kind of doing a recon mission to look for those areas of gripping, of holding, and then letting go. Let's just take one more breath in this neck pose here. And then the same thing, wherever you were is fine, release. Take your left hands now to the left temple and bring your head back upright. Okay, so now I'm gonna, it depends on your chair and what it's shaped like. I'm obviously using an armless chair. Some of you might need to just reach below the arm. We're just gonna do a simple side bend here. So I'm gonna take my block. There's no magic formula for where the right place is, right? So I'm just taking it enough away from me. I'm just gonna gently place my right hand down. I like to come up onto spidey fingers, but you do whatever feels good. And you could certainly reach your arms up and over, or you could take that left hand to the top of the head. I like to do that because then I could play with opening up through that left armpit, right? Using my elbow. If this is too much, just hold on to the chair. Don't go too far. And you also don't have to keep so open. So if you want to be a little bit more closed, that's fine too. So even in this position, I'll invite you to just really notice if there's places in the body where you might be holding on to some tension. For example, it might be that this isn't comfortable and you just want to bring this down. It might be that you just noticed your jaws holding on to tension and you could just see what you could do to loosen it. Maybe have some space between the upper and the lower lip. It might be that it would be more comfortable for you to look down. So song is not collapsing. It's being aware. There's still a little bit of yang in it. So there's still a little bit of, for example, muscular activation, but it's really noticing where you're getting in your own way. And it's sort of like on a psycho-emotional level, how sometimes we also don't see that our own beliefs and experiences cause us to see things that aren't necessarily there, right? Like when we project into the world. So song is also this way beyond the physical body of also letting go of enough that we can actually see things as they are. Let's just take one more breath here, my friends. And we'll come all the way up. You can pause for a moment. There might be a release. In yin yoga, we're not so much working at the muscular level, but at the deeper tissue level, particularly with the fascia and the connective tissue in and around all the joints of the body. So it's more of a yin practice, and that way a deep practice. And we could set up for the other side. So as you're ready, and again, if you prefer to keep your arm overhead, that's fine. If you prefer to keep your hand like that, that's fine. You can also just release through the head. And then we'll go back to that, really the noticing of what's happening in the inner landscape, even the tone of my voice might be bringing up some things for you. What I'm talking about might be bringing up some material from your life. And so we notice these things, and then we continually work to loosen these and to let go. On a physical level, song is really about loosening the joints, but it helps us as we begin to get into this practice of safely letting go. We can begin to work more with the external world in a way that is what the Buddhists would call wise. And we can also turn on our natural intuitive gifts in the same way that someone in the martial arts might have a sense of what their opponent is going to do even before she does it. Or parents have that, right? A lot of times we have that sixth sense. We begin to be able to see patterns outside of ourselves. Let's just take a few more breaths right here. Little movements always welcome to make ourselves more comfortable or to find new areas of tension where we have the opportunity to release. Good. And then let's come all the way up. Whew. You want to do like a little cat and cow or anything for the spine, that's welcome. And then let's move down into the hip. So I'm just going to take my right ankle more or less over my left knee. So now I'm beginning to work more with sort of the glutes and the IT band here. I could also circle and twirl through the ankle a few times in case there's anything that wants to snap, crackle, or pop. And I could either stay here if you're getting enough, if your hips are being cooked enough is what I usually say in my classes. I could also lean forward a little bit if I want to get some more stretch, we can say. Mm-hmm. And so in this pose, like once I get into this practice of song, which is the noticing and releasing, which is really a lifelong practice. Once I begin to do that on a regular basis, then maybe I can begin to notice my relationship to the external atmosphere. And that in Tai Chi is called Ting, T-I-N-G. And Ting is a kind of listening that goes beyond the ears. It's almost like a whole body, deep listening. So it's still an inward practice, but I'm playing with the outside world. So I might just notice the temperature of the air around my skin. And I don't think you guys can hear it through my earbuds, but I can hear lots of birds in my backyard through the open windows. I could have a really wide focus on the space around me. And so it's my song practice, that inner noticing, that allows me to see the outside world a little bit more clearly. Let's just take one more breath here. And then we'll just very gently come on up. I'm gonna place my right foot down and right away just take my left leg. By the way, some of you might be more flexible and you might want to bring that heel back towards your the area where the thigh and the hip meets, or you could keep it as far as you want. Your knee might be like this. That's fine. It has nothing. Nobody cares what it looks like. So just be comfortable here. And only if you want, come forward a little bit. I could also take in the colors around me, the photos. And I have here, and I'm not going to show it to you, but just because of time, but like I have a little altar for my ancestors. And so actually I have 2 Hebrew words that also remind me a lot of this concept of ting. And in Hebrew, it comes from the story of Solomon. The night before he became king, God appeared to Solomon in a dream. And basically God, kind of like the story of the genie in 1,000 Nights, said to Solomon, "What do you want? What's your wish? I'll grant you one wish." And Solomon said, "Lev Shemoah," a heart that listens. He didn't ask for wisdom, but he asked for a listening heart. And the word for listening that's used also goes beyond the physical sense of hearing, and it's like a whole body listening. So if we could learn how to be really open and see things, we would also, our natural wisdom, our natural capacity for discernment and compassion would come in. So that's ting. So many of our ancient wisdom practices have something similar to this. So I always encourage people to look within their own culture. And I'm grateful to have learned this from both the Indian and East Asian traditions. Let's just take another breath here. And then we'll come on up. And again, you just might want to kind of shake out your legs or do any movement here that feels good. And we're just gonna do one last pose here, which is a twist. So there's a few ways that you could do a twist. By the way, and if you can't do a twist for whatever reason and you want to finish with a forward fold, that's great. You're always welcome to just do that. So 2 options for a twist is we could either just turn to the right, maybe place your right hand to the back of the chair, or, and I'm going to bring my blocks closer together, we can first cross our left knee over our right knee as though we're sitting at a bar stool, even though this is a functional medicine chat, so I know nobody goes to bars. And then, sorry, I did it the wrong way. It should be the right knee over the left knee. And then we'll twist to the right. So either with this twisting or not. And while you're here, if you want to do anything with the head, that's fine. And you could practice song, or you can practice ting. Whichever one feels better for you right now. These are both lifelong practices. And I'll also encourage you, if there's any other explorations you want to do, you're welcome to. Like you could come down a little bit lower on your chair. You could move a little bit from side to side. Might help you get into different sensations. That, by the way, is also known as Ting when we have a little bit more of a narrow focus, and it's kind of experimental. So we're listening, if you will, very closely to what movement might shift. Good. When you're ready, let's just take another breath, come back through center, and then we'll switch to the other side. And you might also notice that one side is considerably different than the other side, totally normal. So I love this practice of yin. I love to do it. I usually do at least a couple of poses a day. A lot of times before I go to bed to sort of help me wind down. And I like to do a longer practice at least once a week. Really gives me the opportunity to become much more internal and aware of my own inner workings, so that when I hold space for other people, including my spouse, my friends, my family, I could do so with sort of a clearer mirror. I could be what the shamans would say, a hollow bone. And we'll just take one more big breath here, my friends. And then we'll come back through center again, just maybe a little move here. If you'd like, you could just bring your hands together to heart center, looking around at both the other faces in the room or the names. Really so grateful that we have this opportunity to be in community with one another. It's absolutely life-saving. We'll take one more big inhale, and with gratitude to one another, we bow. Thank you guys so much. I think Janet put my my website, so if anyone has any questions, you're welcome to get in touch with me through there.
Thank you, Yael, so much. Everybody have a great weekend. Again, don't forget about, if you're planning on coming tomorrow, if you forget about the link to the C-IAYT open house, it's on our website. Also tune to NPR. I'll be on Science Friday, giving the keynote on Science Friday this week. I think it's at 3 o'clock, which is right now. If you don't find
it's already up there.
Oh, it's already up there, yeah. Yeah, but I think it's actually airing at 3 o'clock on the radio itself, I believe. I don't know. But the link is, I posted the actual link there. And Janet, who do we have next week?
Next week we have Niall McFarlane and James Folks.
Oh. Wonderful. So we're gonna have Qigong after yoga, which I think is very telling of our group. Everybody have a wonderful weekend. I don't know about you, but I'm planning on spending most of it outside, and I hope you can do the same.
Thank you.
Thank you so much, Dr. Baer. Thank you, Yael, for a wonderful session today.
Okay. Thank you.
Bye, everyone.
Bye. Bye, everybody.
Bye.